8 signs your back pain is actually an emergency. A few things to consider before you pop an aspirin and tell yourself it's nothing. You recently injured your back. This one's obvious. Whenever you directly injure your back, say you fall, get in a car accident, or something hits you on the back, you'll want to see a professional. You very well could have a spinal injury, says Dr. Troy Madison, an emergency room physician, on the podcast ER or Not. That's a very serious thing. Madison recommends going to the ER. There, you'll probably need an X-ray or CT scan to assess the injury. You're losing weight. Rapid, unexplained weight loss is never a good sign. And when it's accompanied by back pain, it could be a sign of a tumor in the spine. A tumor can weaken vertebra, leading to fracture and pain, and it can also compress the spinal cord or its branches, leading to weakness, incontinence, and many other problems. Write Dr. Christopher Kelly and Mark Eisenberg in the upcoming book, Am I Dying? If you have a known history of cancer or are a frequent smoker, get an evaluation ASAP. Some tumors start in the spine, but more often they spread there, from another location, such as the lung, breast, kidney, and prostate, which makes getting treatment fast even more crucial. You can't control your bladder. Back pain combined with bladder, or bowel incontinence, or a feeling of increasing weakness, or numbness in the legs, pelvis, and hips, could be serious. These symptoms may be indicative of Cauda-Equina syndrome, writes Dr. Sid S. Rahman of Westchester Health, which is usually caused by severe compression of the entire nerve sac in the lower spine. An infection or tumor is often to blame. Here are signs. Your upper back pain is something serious. Your pain wakes you up at night. In many cases, back pain from overuse, as well as wear and tear, will feel better when you let yourself rest. But if you're constantly waking up from your pain, and a terrible mattress has been ruled out, it could be a sign of something less benign, such as a tumor. If your pain is combined with a loss of appetite, fever, or weakness or numbness, you've got stomach pain too. Localized back pain will rarely migrate to the stomach. Stomach pain, however, can often be felt in the back, which means that your back pain could be originating from the abdomen. A serious condition to look out for, an abdominal aortic aneurysm, acute lower back pain that does not follow an obvious trauma or movement associated with the onset of pain, can be a symptom of an enlargement of the aorta, large artery, in the abdomen, called an abdominal aortic aneurysm, says Dr. Rahman. If your pain is severe and continuous, get to the ER. You're having spasms of back and pelvic pain. If your back pain is less continuous, and instead occurs in spasms, you could be passing a kidney stone. If that's the case, you may also notice some blood in your urine. Head to the ER to be diagnosed and treated. You'll likely be given an IV to help flush out the stone. You have osteoporosis. If you have known osteoporosis, and your back pain comes on suddenly, you could have fractured a vertebrae. Common causes could be a recent fall, lifting something heavy, or even a violent cough. The pain should go away on its own, but if it persists, you'll need to see a doctor. You might need a procedure called vertebroplasty, in which cement is injected into the vertebra to strengthen it. In the meantime, try exercises that help relieve back pain. You're experiencing numbness. The fact that spinal cord damage could lead to permanent paralysis should be enough to get you to the ER stat. If you're experiencing back pain and numbness, especially in the legs, this condition often indicates an injury to one or multiple lumbar nerves. Injuries to such crucial nerves can cause total paralysis if they are not attended to on time, they say. Get there as soon as possible. Thank you for watching Knowledge Square. And be sure to subscribe.